Hi guys.
Welcome back.
Today we're going to talk about a little bit of a touchy medical subject that not a lot of people talk about because sometimes it can be embarrassing, and that is incontinence.
Incontinence. Different types of incontinence.
There are different types of incontinence.
So let's start with just basics. So there's urge incontinence and stress incontinence. What is urge incontinence? Is the I guess the urgency to always want to pee.
Gotta go right now.
Yes.
I used to have a commercial like that.
And that's like you're in the mall, you're shopping, you're always the person that knows where the bathroom is. You know where the best bathrooms are.
Yep. And when you get the sensation to go, you can't wait. You got to go right at that moment.
Yep. And then the other type of incontinence is called stress incontinence. And that's usually we see that in most patients, you know, with a little bit of age, or especially if you're pregnant or have had multiple kids, you're going to have some type of urge or stress incontinence. And you would be the person at a birthday party that is not jumping on the trampoline.
Yeah. So jumping on the trampoline can cause some urinary leakage, sneezing, belly laughing, coughing. All of that can cause a little bit of leakage. And in a lot of patients, we see combinations. So we see some stress incontinence and urge incontinence. Dr. Thomas had kind of touched on it. It's a weakening of the pelvic floor. We see it commonly in women who have had childbirth, had babies, because it weakens our pelvic floor. Especially
if you had multiple kids in a in a shorter duration. So the 2, 4, 6, 8 kids, especially in the South Side, everyone's got like 3 to 4 kids, and they're all like back to back to back to back.
Irish siblings, as they call them,
or Irish twins.
Irish twins.
Yeah, yesterday I met a Irish triplet.
Oh my gosh.
Twins and then another child. So definitely probably
that
suffering.
Mom had a weak pelvic floor.
Yes,
for sure.
Unless she's been strengthening it. So how do we strengthen it?
Yeah, so a lot of you guys have probably heard about Kegel exercises, right? So a lot of times your gynae or your family practice will tell you, we'll do these Kegel exercises.
Do them at every stop sign and every traffic light.
Yes, which is basically that muscle that you use when you're urinating to stop the pee. You're trying to contract those muscles. But I tried them. They are kind of hard to do. It's a hard muscle to isolate when you're not peeing. You have to kind of know exactly what you're doing to get them to work. And you have to hold it for a long period of time and kind of relax it. So holding it for like 5 to 10 seconds before you let it go. And it can be difficult.
And you'd be consistent with it, right?
Yep.
It's like if you don't use it, you lose it, right? So it's the same thing if you're trying to go to the gym and work out your chest muscles, your bicep muscles. If you only do it here and there, it's not going to build the tone and build the muscle mass that it's supposed to.
Yeah, and so now they have other options medically, like pelvic floor physical therapy, where you go in to an office and a physical therapist who's trained just on pelvic floor exercises can lead you through those pelvic floor exercises. Or we have a very exciting non-invasive option. So with pelvic floor PT, you're definitely getting to know your PT. They're down there, they're in it. We have something very exciting here called the Emsella Chair, which actually helps you do Kegel exercises, and you don't have to get naked for it.
Yep, you come in your comfortable, workout pants or shorts, and it is using a technology called high-fem technology, which is high intensity focused electromagnetic therapy. Basically, it's a big magnetic chair, weighs about 400 pounds. You just sit on it with a cup of coffee or a drink, watch some TV or read a magazine, and you let the machine do those Kegel exercises for you. And how many Kegels does it do?
11,000 in a 28-minute session.
Yes, 28 minutes, 11,000 Kegels. I don't think you could possibly do 11,000 even if you tried for every stoplight at traffic light on your way to and from work for the next 6 months.
Yeah, it's kind of wild, right? You're just sitting there. You're not actually doing the work, but you can feel your muscles contracting and relaxing. And so for someone who has stress incontinence or urge incontinence, it's a great non-invasive option. Typically, we recommend how many sessions?
So it's twice a week for 3 weeks. So it's the ideal treatment package is about 6 treatments, and that's done over the course of 3 weeks. Doesn't mean you don't have to do them again. I mean, but if you're very good at Kegels and you just wanted that jump start, then sure, you don't have to do the treatment again. But most people are busy and are going to forget about doing Kegel exercises. So most of our patients come in like once after the treatment is like once every like 6 to 9 months or 3 to 6 months. And that's, again, based on severity, right? So mild, moderate. If you're severely incontinent or you have some type of prolapse, we're not going to recommend that you do the chair. That's when you probably need to go see a specialist, a urogynae, that they might say that you're a candidate for a sling or bladder sling.
Yeah, and it's not just women, right? Can you touch on men?
Yeah, I mean, men also can have incontinence. Especially after some alcoholic drinks, you tend to continue to always go to the bathroom. But as men get older, the prostate gets enlarged. We have trouble kind of holding our urine as well, and we're always trying to go to the bathroom. So anything that can strengthen that pelvic floor is going to be very beneficial, right? So it is not, this treatment is not just for women. It's definitely used for men as well. Also, there is some sexual enhancement as well, and that's because it's going to increase blood flow to the pelvic area. So in women, it helps with orgasms. In men, it helps with keeping their
Erections.
Erectile dysfunction, keeping it going. I guess.
Yeah. So it's a great option. It's very unique to our practice, and we're really happy to have it. But we don't talk about it very much because, again, people are embarrassed and they don't like to bring it up. So we wanted to do a tea time so that people could kind of know we have it. We're open to questions. Schedule a consultation. Come on in.
And what's nice about that chair is it is a treatment that we could have you demo, right? Like, so a lot of times until you kind of it's really hard to explain it unless you actually get on the chair and you can feel it. So we can do like a 5-10 minutes of demonstration where you can get on the chair and actually feel what those contractions are. There's different intensity levels. I think everyone who does it kind of realizes like, oh, wow, this is going to be effective. It's in the same also family of technology that we have at the office, which is the Emsculpt, which is also for building muscle on the abdomen, the glutes, triceps, biceps. So that technology is pretty amazing. People also will ask, are you sore after the treatment?
And no, you're not. So and there's no downtime. You can exercise the same day. Everything is fine the same day.
Yeah. So it's a good option. I mean, it's again, people are usually embarrassed to talk about it, but it's so common. We always say if you have your first child, it's very good to like start thinking about doing pelvic floor therapy, whether that's just doing a Kegel at the stop sign or the traffic light, or if you want to get 11,000 Kegels in 28 minutes, we are the place to go.
Yeah. If you have any questions, come on in or give us a call.
Yeah.
Thanks.
Love to see you guys. All right. Cheers.